I'm April Lenhard, and I'm here to pitch the Dash syringe. I recently discovered that half of all medication errors are a result of drug administration, and a full two-thirds of those are just from injections. The Dash syringe, also called the Dosage and Safety Help syringe, is made to help medical professionals prevent potentially fatal overdosage by two ways, both visual cues and dosage markers. Before I go further into the technical specifications, I want to talk about exactly why this is such a big deal to me. About 2 months ago, I was on my way to the hospital for a severe anaphylactic reaction. What that means is I was having an allergic reaction, so bad that my throat was closing up and I couldn't breathe anymore. The only way to fix this is by using a drug called epinephrine, also known as adrenaline. The only other time that you use epinephrine is in a situation where your heart has stopped beating. Emergency workers can actually use it to restart your heart. As you would imagine, adrenaline in that situation is very different. You use it with a different dosage, also called concentration, and you use it with a different route, meaning that you give it intravenously instead of intramuscularly. However, my medic, when faced with a respiratory event, which is what anaphylaxis is, treated it like that cardiac event, meaning that my heart, when it was already just ready for a respiratory amount of epinephrine, instead got the full cardiac amount. So it was overdosed with about a 10 times concentration of what it was ready for. Fortunately, I'm extremely young comparatively, so I only ended up with some heart issues, and as a result, I'm still on a heart monitor. However, I am very lucky because I am still alive. A lot of people die from that exact same thing every single year. This is a very preventable mistake. What the Dash syringe is trying to do is make sure that that never happens to anyone else, because honestly, there's no reason for that to ever happen. There are two ways that Dash syringe is going to make sure that that doesn't happen. The first is there are going to be pre-scored markings along the barrel of what you would imagine to be a normal syringe. This would help because it would make sure that people both understand that there's a difference for a child's dose and for an adult's dose, and it uses kind of that memory technique of making sure that you understand, okay, I should only be filling it up to here. If I'm tempted to keep going, that's probably not the event that I'm working with right now. The second is there's going to be a clear label on each syringe that says anaphylactic syringe, use epinephrine 1 to 1000 dilution, IM sub-Q only. That is about as clear as you can get to show that you should both be using this for the right dosage and the right route. This is very similar to what insulin syringes currently employ for diabetics. This could be used in a multitude of situations. It could be used for emergency vehicles, emergency rooms, infusion rooms, and crash carts on every single floor of a hospital. It could be used anywhere that time is of the essence, but there are multiple medications with multiple potential dosages. You might be thinking, why couldn't you just pre-draw these medications? Normally you can't though, because since you have epinephrine for both adults and children, and since you have it for both cardiac and respiratory events, it's just not logical to have all of those already pre-drawn and sitting out there. You also might be thinking, why can't you just have EpiPens? That would be a good idea, except EpiPens are extremely expensive, and hospitals are not going to commit to spending hundreds of dollars per EpiPen. Another thing that this displaces is a standalone little label. Right now, the closest thing you can get to what this is are basically little Post-it notes. And if you do have time, you can go around individually on every single needle, sticking like this little Post-it note that basically says that you should draw the line to here. However, in the words of the infamous philosopher, ain't nobody got time for that. The technical specifications of this would be there's a Luer-Lock syringe for IM and sub-Q needles, specifically for the 1 milliliter unit size. Our market would both be for hospitals and fire departments all across the country and eventually worldwide. Our specific ask for Georgetown today is that if we were to receive a grant, we would be using this primarily for R&D funding. I'm an EMT and I'm working with an almost 40-year experienced oncologist. And what we're trying to do is we're looking for exactly what hospitals would be looking for. Besides this pre-scored marking labels, besides pre-scored markings on the barrel and clear labels, we're looking if there's anything else that we could do to help medical providers get the care they need in order to make sure that they have a correct barrel here. Thank you so much for watching this presentation, and I'm hoping you're staying safe. Have a good day.